many setups that when you implement these kind of technologies, you make things move faster, you also collect better revenue, and overall services will improve.
Yeah.
Then the other key thing that we're also looking at is in terms of enhancing the capacity of our facilities to diagnose conditions. There are cases where you find not our facilities not being able to do the diagnosis. And here we are looking at equipping some of our facilities with things like MRI that is not currently available within the county. Also expanding facilities that have the CT scan. We currently have in one facility. We can add one more facility. And also increasing the range of diagnostic services that can be provided in our current facilities. The other area also where we see a great opportunity is in expanding the specialist services that we have.
Yeah.
We have sent doctors for training, and quite a number of them will be coming back in the course of this period, and we expect them to come and help us to increase the range of specialized services that we are able to provide as a county, and that will really help us a lot. Then the other key area where we'll also seek to strengthen is partnership. You realize as a county we cannot be able to do things alone.
Yeah.
So it calls for us to work with other partners.
Yeah.
And this has worked well before. We've worked with the Safaricom Foundation to equip maternities, to introduce telemedicine in Chemolingot. We've equipped Burin and Oruk health centers. So again, we will be reaching out to more partners to ensure that we can tap into resources that are out there. Then another key area which touches on prevention is on water and sanitation.
Yeah.
You realize that we have preventable diseases that are still with us.
Yeah.
So one way of reducing them is to ensure that we improve sanitation across the county. So we are developing a roadmap that will help us to ensure that we move. Our current latrine coverage is slightly more than 50%.
Yeah.
Where we have some sub-counties at 90% at the highest, and some as low as around 3.6%. So what we want to do now is really to move to ensure that we increase.
Yeah.
Because that will go a long way in reducing the preventable diseases.
And maybe before you go on,
yes,
on what you spoke about there's the plan that the county had on the health sector, the county strategic plan.
Yes.
Where you had you wanted to recruit over 200 CHV.
Yes.
Through the program, and community units are per se, most of them aren't active. I may need you to address that as you go on.
Okay. Yes, thank you very much. As I said, community health service is one of the key pillars that we are looking at strengthening. So one way of doing it is to have the community units.
Yeah.
So we've been able to increase the community units across the county to 129. And then we've trained CHVs. We have a total of 2,190 CHVs across the county. So what we are working on now is to implement the act that was passed in October last year. And that will entail now ensuring that these community units are working well, that they are functional, and they are providing the services across board. Yeah, so maybe the other last thing that I wanted to emphasize is, and it touches on what you had said about equity.
Yeah.
You realize as a country, we have the universal health coverage that is coming up, that has come up. So as a county, we've had the opportunity to identify indigents, those who are not able to pay for themselves. So we have a total of around 18,711 within the county, whose premiums are paid by the national government. But then the other key strategy that we need to really work on is to increase the overall enrollment to NHIF in our county. We are now at 22%, which is quite low. So if we can enroll more,
Yeah.
then it means our facilities can benefit from offering services through NHIF.
Yeah.
That will also reduce the waivers that are very costly to our health system. Yeah, then I think I haven't touched on the hospitals.
Yeah.
One area where we want to also ensure we work on is to increase the number of theaters within the county. Currently, we have we were able to increase by one in the last period, or rather by three, with one being fully functional and two almost being operational. That's in Kabartonjo and Mogotio. So within the 5 years coming, we'll want to ensure that each and every sub-county hospital has a functional theater, and then we also prioritize on a few high-volume health centers that can have that capacity. Yes.
Yeah, so I would like to come back to you, Mr. Wesley Kiprop. As you do your day-to-day activities of civic education and public participation, maybe you might enlighten our audience here and the online audience of what are the most rising issues within our communities as from the ground level, the issues that are being raised maybe severally.
Thank you very much, Emmanuel. Your concern is on how the community are catching up with in terms of their participation. So far, I want to believe that, as I had earlier indicated, that the community are quite empowered nowadays, and I see them really inject some good interventions, if not participation. They have had knowledge on how matters of development is supposed to be undertaken, and they feel part of it. They are able even to engage the leadership. The sense of rights is well catered for. They are not in darkness. Like now, as we pursue the third generation CIDP, I see some sense of quality contribution because or courtesy of what we have done, and of course in partnership with other entities. They have now gotten the idea on how to really ask for their services. If it is a project, for example, at least they have an idea, and I attribute that to the role of our technical actors from the respective departments. I want to say that as a government, the respective departmental aides or actors are tasked to ensure that they really explain what is expected from the community or even from the same actors.
Yeah.
For example, as much as engineering might be a bit, it might sound so elitist, even the medical terminologies, I know the same actors are trying their best to explain. Like now, we are expected as a community to understand the issues on the bill of quantities. I've seen officers try to explain.
Yeah.
Like now, when we talk of volumes,
Yeah.
they try to kind of do a domestic version so that they are able to understand. So that is the essence of, or as a department, we are trying to ask all the departmental aides or the actors to try their best to explain in the simplest way for the sake of the understanding. And of course, along the way, we try our best to enlighten our community, and I've seen them regroup or try to come up with a way of or kind of a leadership attached to every project in the form of project management committees, and we try our best to empower them give them knowledge concerning the respective project. Like now, when it comes to water,
Yeah.
you would see the same residents are able to understand the types of, you know, the required, say, facilities for that case.
Yeah.
The types of pipes for that matter, and it is courtesy of the departmental engineers. So that is how we converge. We are expected to at least interact with the community, and I think so far we have done well. And of course, we want to ask everyone to join that direction. We ensure that the community is well empowered so that they get the value of their money when it comes to, you know, allocating resources.
Yeah. So maybe in a minute, you can just give me maybe one issue that has been concurrent from every part of Baringo, apart from side of insecurity. Insecurity doesn't affect sides like Eldama Ravine at the moment. Maybe you can give me an issue that is being raised concurrently from the sides of Eldama Ravine to Tiati to this side of Baringo North, or every side of Baringo. What is this issue that is being raised concurrently?
Well, concerning our line of action,
Yeah.
there is still that low level of advocacy. So I see that the community are still yearning for sufficient or effective awareness, which I think as a government,
Yeah.
that is an area of concern.
Yeah.
So, and I am hopeful that we'll try our best to ensure that at least we reach the same community, and that is why I acknowledge the role of CSOs, which they have come in Nandi to complement that CAP.
Yeah, that is well said. You can join the conversation on Baringo News, Ravine News, and ZGG online. Back to you, Mr. Michael Ngetich. I would like you to address this. From your experience in the last 5 years, what other issues limit budget implementation and service delivery, and how do you want the county government to address them?
Okay, thank you, Emmanuel. I think from the onset of devolution, I think we are progressing well.
Yeah.
And lessons learned from the first years of devolution,
Yeah.
and then the last 5 years, which is almost complete, we have learned a lot, and we keep on improving. So I think for the past years, 8 or 9 years or so, the challenges that we have actually been going through is actually the issue of well-informed citizens. And that is why you realize when we look at the economic impact in terms of investment, I think I said earlier that our resources have always been spread so thinly. And when you try, well, maybe this is the time actually to do some impact evaluation. And I am very sure that the report that will come is actually about resource allocation has been so thin.
Yeah.
And that is why you realize that some programs until now are not yet complete. Because by the time you are allocating a resource, maybe at that time it's a need, but going forward, one NG will then again to forget where they had invested previously, and you realize that that particular facility which has been invested on is not in use, and a lot of county government resources have been sunk into that particular program or project.
Yeah.
So that's actually a big issue. And I think, as I've said, we are learning. And in this third generation CITP, we are now actually shifting focus now in terms of problem identification. We are not this time round. We are not prioritizing projects, but we are using programs. So that when we will be evaluating ourselves, we'll be evaluating a certain program.
Yeah.
If it was a development need, then we'll want to know this program, how much resources were invested in this particular program, and then from there we will want to know the impact. That is impact evaluation.
Yeah.
After 5 years, we'll be able to tell how many people have been employed in this particular program in terms of wealth creation, how much our community or our people earning from this particular resource investment.
Yeah.
So I think that is where we are going, and that is why currently we are doing a very serious work on development of account fact sheet the department are feeling, so that we can get a clear baseline.
Yeah.
So that after 5 years or 2 years, we will be monitoring ourselves and see whether we are progressing towards our achievements after 5 years.
Okay, that is well said. I think we can move to the next session where we'll be taking questions from the plenary, the audience here that we are having. Maybe if you have a question, you can raise your hand and a microphone will be passed to you. Anyone? Back there. You can start by your name.
Okay, my name is Isaiah Biwot. I'm a human rights defender, also working with an organization called Citizen Participation Forum here in Baringo. My question goes to the panelists because they have actually, in their conversation, they have insisted that there is a cap among the people that the citizens on the allocation of resources, the equity in this, because what's happening in Baringo is about allocation of resources equally, not equitably. And another question also, it goes to the Department of Civic Education, because that is the department which is charged with educating the citizens, because currently we've used a lot of resources. We have allocated billions of money, which we are not feeling. So what is the department doing to ensure that the citizens actually know the right way of allocating resources? The last question is to the director of
Planning.
Yeah, the director of planning, because during public participations, we citizens, we are being left to decide on allocation of resources. Even in technical issues, we don't have technical people. What are they doing to ensure that during public participations, we have technical people who can guide the citizens? Because that is what is lacking. That is what has made us lose millions of resources, because laymen, we are laymen. We just allocate money, and that is why we don't feel the impact of the resources. Thank you.
Yeah, maybe we can take another question.
Thank you. My name is Godfrey Kipsoy.
Yes, Godfrey.
I'm the secretary to Baringo CSO Forum. Also, I'm an active citizen. My first question is around the development of the third generation CIDP. Going from the previous generations, we've realized that as a county, we are developing a very ambitious CIDP, which at times does not speak to the current needs of the citizen. So what's the strategy for our county government to ensure that this time round we come up with a CIDP which can be implemented within the stipulated time of 5 years, because this is a 5-year plan. Number two, I think Director Ngetich has mentioned clearly about the thin allocation of resources, and this is largely contributed by maybe the members of the public during public participation, and also I think also it's contributed by the Ward Development Fund. So what's your thinking about the Ward Development Fund? Do you think that our county government, are we feeling that maybe the Ward Development Fund is contributing to the thin allocation of resources? And if so, is there any plan to do away with the Ward Development Fund? Finally, on the role of the ward administrators. As a county government, I think we have the 30 wards. And, so we want maybe help us understand what's the role of the ward administrators in preparing the members of the public to allocate resources to the various needs at the ward level. Thank you.
Thank you so much, Godfrey. You can pass to the next one. And please, maybe you can have one question, please.
I represent Baringo County Forum, and I have a question concerning the issue of HIV and AIDS. A very recent study and research showed that young people are very, the infections of HIV and AIDS are very rampant among the young people. What does the county government of Baringo have in place to ensure that these infections and the young people are educated on the issue of HIV and AIDS? Thank you.
Thank you. Maybe we can have a question from a lady. Yeah, thank you.
Good morning, everyone.
Good morning.
My name is Janet Nandongoli.
Yes, Jan.
I am the communications coordinator for Activista Baringo chapter and a member of BACSOF. My question is, since the inception of devolution, Baringo County has never been able to realize its target on revenue. Moving forward, what does the county government have in place to ensure that we realize the targets are met? Thank you.
Yes, thank you. Any other question? Okay, we can take this last one. Microphone, please.
Good afternoon. I'm just from this page. I wanted to ask a question on concerning water.
You've said Anthony.
Josephat.
Josephat.
Yes.
Yeah.
Question on water. So, as we observe in these areas, we see most waters drain the lowlands and the other ones to these sides. But we are seeing these waters are not what utilized to the standards. Maybe could be through dams in these areas. So what is the Department of Water doing to tap these waters so that they may be used for irrigation and other activities in our communities? Also, in the same note, we observe a lot of pollution in these waters, especially which are draining to the lower parts. So, between the Ministry of Health and Water, do you have any collaborative methods of improving these waters or questioning users on reducing pollutions?
Yeah.
Thank you.
Thank you. So those are the questions that we'll be taking. We will start with how they were coming respectively. We'll start with Isaac's, and that is about the allocation of funds. And I think he was directing it to Mr. Ngetich. If you can address that first.
Okay, thank you, Bwana Biwat. These are good questions. I have said we have been distributing resources equally, not equitably. I think this is actually a big question in terms of word-based allocation. It is true. This money is distributed equally. If it is 20 million, it is 20 million across all the wards, all our 30 wards in the county. But again, the other resources which remains, which we call them the flagships, and I think this one is going to be addressed. I know that you know that budgeting is actually can I say it's political in nature.
Yeah.
But you realize that to bring all the wards, they are given equal allocation to decide on their areas of their need. But again, what we are doing going forward is to see this sub-county is good in what? In terms of economic empowerment, in terms of building the economy for our people. So we will be looking at the competitive and comparative advantages of the specific sub-counties, and they will be allocated resources. When you go to Tiati, we will be looking at what is good in Tiati. Then we focus on that and invest in that particular program or project. So I think going forward, this one will be addressed, and I think I also said about the development partners who are coming on board. So those who wish to support Baringo County government, they are coming on board, and then they'll also be directed to support those particular areas which have been left behind. And there's another question on citizens by Biwat.
Yeah.
That citizens are left to decide on, but technical people are not there.
Yeah.
As if you realize what you have done currently in our CIDP, we are taking all the technical people, or if not all, but majority, to the field, so that they can actually advise our people when we are formulating this that generation CIDP. And I think the governor again has been firm on this. From the time we are doing this ADP,
Yeah.
he actually commanded that all technical officers should be in the field so that they can, this public participation thing becomes guided. At times you may realize wananchi may want, when it's rainy season, wananchi can tell you we want to draw some water from a certain river, and that river is seasonal. So the technical people should be there so that they can actually advise wananchi, or they can give you a road. For example, such a ward, for example, most of the roads from such a ward are actually connecting the main road to Tenges, all the way to Kapkelel. All of them are heading to Kapkelel.
When we come to another person.
Okay, thank you, Jeffrey Gipsoy.
Yeah.
I talked about ambitious CIDP. Our first generation CIDP was around 82 billion. And the second CIDP was around 65 billion. And this time round, we are very keen. We will be working on chapter 5 of this CIDP on our implementation framework, whereby part of it we have the resource mobilization framework. We will know who is doing what. Having looked at our past, we'll be able to look at our resources. For the last 8 years, we know our resources. We can project our resources. Then from there now take up, who will fill it? Is it the national government? Is it the development partners? So we will indicate county government will finance this, development partners will finance this, and then the national government. Because this time around we are saying the kind of CIDP we are doing is not a county government CIDP. It is called County Integrated Development Plan for Baringo County. It is bringing all the actors within Baringo, whether national, county, or development partners. So I think going forward, we will work on our resource mobilization framework, and we will be able to indicate who is financing what.
Okay.
Okay, I think another one is on, you talked about ward fund. I think this one again, I think this one again, there's sensitization which is actually ongoing, and the political class, that is our governor and the MCS, have actually discussed at this point. And I think from their discussion is that if you have been given a word development fund, they are requesting, they said maybe please just have a program between 5 million, 10 million, or just to get one project costing the whole of that that word fund. I have a good example of Mukutani ward. In the current budget, our NG actually agreed. They had a budget of around 25 million. Then they said the 5 million will go for, because they bought the machineries, they put 5 million for fuel and maintenance of the machineries. And then the whole of 20 million was put in an elder facility. Just the one. When it comes now to monitoring, it becomes very easy. If it comes to the data collection, our technical officers will be able to collect data from that particular facility. In terms of monitoring progress, it becomes very, very easy, and you'll be able to complete that particular project on time. Maybe I can extend, so I can say something on that again. Is I think I forgot in that in our last session.
Quickly.
Normally we give a lot of projects. These projects require data collection. Our officers go around collecting data, even until June, when the financial year is closing. So imagine procuring, monitoring all those projects. In a word, for example, if you bring around 20 projects times 60, that becomes 600 projects. How many technical officers are there to collect data, to monitor progress, develop BQs, all those things? So please, I had our residents to actually prioritize high impact projects. And then what that means, I think there maybe Wesley will handle that one.
Yeah.
And then on
you can maybe
revenue.
Yeah, the target revenue as you finalize.
Okay, revenue. I don't know if I can pass it to my colleague, to Roxana.
Yeah, it's okay.
Okay.
Maybe you can pass the mic.
Good morning. My name is Roxana Kandie from Economic Planning Department. I just stepped out. Can I get a question on revenue?
Madam Roxana is on. We have been setting our revenue targets and we have never realized. So, what is the county government doing to realize those targets?
Okay. Yeah, I think it's true that the county government has not been able to realize the revenue targets, especially over within the CIDP that we are actually implementing.
Yeah.
And there are quite a number of reasons as to why the revenues were not achieved. One of the critical reasons is the impact of the COVID-19 pandemic that we all know that it affected a lot of activities, a lot of sectors in so many ways. So the impact of the COVID-19 is a major contributor in the recent past as to why the revenue was not realized. Number two, other reasons that maybe in terms of the broadening the revenue base, maybe there are areas that we need to explore. So we may be looking out for revenue from very limited sources, but we have the potential to expand these sources so that we can be able to enhance our revenue. When I talk about the effect like of COVID-19, we are looking at the, containment measures that were put in place that included no movement, meaning traders were not able to, carry out their normal activities in our auctions. We could not raise revenue from the auctions. In the hospitals, the revenue went down. We know that majority of the people even shied away from hospitals, and so many other things that came with the COVID-19. So I think there are quite a number of measures that have also been put in place by the county government to see to it that the there is enhanced revenue going forward. Some of these things is what I've just said.
Yeah.
Relooking at the finance bill
Oh.
and trying to see what else can be introduced into that that can be of, can be a revenue source.
Yeah.
I can give a good example is the kind of natural we do have.
Yeah.
We see a lot of things going around the sandalwood. We know that if we were able to regulate and to bring, into perspective,
Yeah.
it will not be an illegal trade. And it could be one of the things that actually raise a lot of revenue from the same. Other natural products, like we are talking of the aloe vera, we're aware that there's a lot of black market going, taking place.
Yeah.
And a lot of our products are leaving this county through the black market, through that aloe. So we are saying the measures that we are looking at is to broaden the revenue basis.
Yeah.
This.
Yeah.
So I think.
Yeah, I think that is well said.
Yeah.
Maybe we can move into your questions, Mr. Wesley Kiprop. You can address the issues on that was said pertaining your department.
Thank you, and it was a concern from Biwot, and I want to assure him that we are committed to see that we do our assignment as civic educators. But still, I want to admit that we are still we still have challenges in terms of capacity. We don't have enough personnel to serve sufficiently within the county, and that is why I had earlier on indicated that I want to appreciate the contribution by the existing CSOs within the county who are doing the same mission of advocacy. And towards this planning, it means at the end of the day, as residents, we need to ensure that we try to suggest to the leadership that we require that we have enough personnel for that matter. And again, we have done our best to sensitize or capacity build our departmental actors to continue doing the same, because at the end of the day, those are the ones again who have the knowledge on specifics or in their respective lines of action. So, and I know they do their best, but still I know we are yet to ensure that we have sufficient personnel. Sorry. There was a concern about the role of our administrators. Really, those are the sorry, those are our coordinators on the ground who are mandated to see that. sorry.
Sorry. I think maybe we can come to you.
So I can respond to, I think there were two questions. One was from Barsongol regarding HIV among the teenagers. As a county, our prevalence of HIV is around 1.3%, but it is true that current infections are quite high among the teenagers. So there are three key things that we are doing. One is community engagement. And we began this just before the election, where we were able, in conjunction with the National AIDS Control Council, to bring together chiefs, assistant chiefs, and village elders for a sensitization on the threat of HIV among teenagers. We were looking at the threat of HIV and also issues of sexual-based gender violence. I think those were the key things that we were looking at. So that was an initial sensitization. Then we'll now move to the next level, where we will do capacity building across the community. So that's one. And we also involved the CHVC in that particular engagement. The other key thing also that we are doing is we are focusing on adolescents who are positive, and we are training them on social behavior change, and the aim is to make them champions in our community. so that they can spread messages that can help to create positive behaviors. Then the third thing that we are also working on is on ensuring availability of condoms, because that's also another key strategy.
Yeah.
Then there was a last question which touched on health also by Josephat.
Yeah.
He was asking about what are we doing to protect the water sources from pollution.
Yeah.
Yeah, that is very true. We've had in the last 1 year where we were working on ensuring that and this focused on Baringo Central and Baringo North, where we worked with the communities to ensure that they have proper latrines. So there's an approach called community-led total sanitation, where we work with members of the communities to really bring about shame of defecating outside and get people to act to have toilets. So in Baringo Central, we are doing well. We are at 90%. In Baringo North, we are at around 78, heading to 80%. And we are also working with the Water Trust Fund to protect some of the water sources by ensuring that all the villages that are in the upstream are not polluting the environment. But then there's also the other that we need.
Yeah.
Yeah. Thank you. I think those were the key areas that I needed to respond to. Thank you.
Yeah. Yes, you can join our conversation on Baringo News and Ravine News. Maybe I can give you each 1 minute for your closing remarks as we wind up the conversation. We will start with Mr. Ngetich, and I kindly bear with me with the 1 minute that I've given you.
Okay, thank you, Emmanuel. So what I want to say is that currently we are in the process of formulation of the third generation CIDP. It's across the county and it's running until Monday. So I'm urging our residents to kindly propose programs which will impact their lives. Secondly, we have provided a platform for the professionals and those people who may not reach us during those forums on www.baringo.go.ke /forum/. That's www.baringo.go.ke /forum/. So you can, this is where we expect members from diaspora or from the county, around the county, to send their programs and priorities to be addressed. And in that link, we have a link for priorities, we have a link of interest of development partners, and we have a link for investors. They can say where they really need to come and invest in our county of great diversity. Thank you.
Yeah, well said. We will move to Dr. Patrick Barrett.
Thank you very much, Emmanuel.
Yeah.
I think for me, my call to action is for us as communities to engage in this process and let us invest in efforts that will improve the quality of our services. As a Department of Health, we really want to focus more on equipping the existing facilities so that we are able to provide quality services. I think that would be my main clarion call for today. Thank you very much.
We will move to Mr. Wesley Kiprop.
Okay, thank you. As a parting shot, I would just want to urge everyone to ensure that we do continuous awareness for the sake of our people to be able to be well informed, and of course they participate towards development. Thank you very much, and you are welcome. Maybe to repeat, the online link is www.baringo.go.ke /forum/. That is where again you can still engage online wise to put your information as an individual and as an organization. Thank you.
Yes, to our online audience, thank you for joining us during this high technical level panel, where we have discussed issues, health, water, and public participation and civic education in Baringo County. As they have emphasized, you can bring out your issues through the www.baringo.go.ke/forums. I will also like to laud our partners in this forum, the ZGG, BASCOF, IBP, UK Aid, ACT, and so many others who have taken this initiative to promote awareness in the county. I have been your moderator, Emmanuel Langat. Thank you for your time. Keep it Baringo News, keep it Ravine News. Till next time, thank you.